go over is Denture Care. So I'm gonna wash hands. Knock, knock. Good morning, my name is Xavier. I'll be your senior for today. Can I check your name, Ben? Mrs. Meredith Gray. Mrs. Gray, I'll help you with Denture Care. In this particular skill, she will be sitting on a chair. So we'll just say she's sitting on this chair right now. I'm gonna grab my supplies, I'll be right back. So I'll wash hands, grab the supplies. I have my 2 sets of gloves, and then I have the supplies laid out here. So she is sitting on a chair. I'm gonna go ahead and put on my first set of gloves. And we're gonna grab a few supplies. So the first thing we wanna grab are a toothbrush. We have toothpaste, kidney basin, and then we have the dentures, and we also have a little washcloth. So in this particular skill, we're gonna have a sink. So I'll grab this sink over here. And we'll just pretend this is the sink on here. On the Red Cross, what they're going to do is they're actually gonna label the area with the sink. It'll just be a paper with the sink labeled on it. So Mrs. Graham, I'm just gonna head over to the bathroom. I'll be right back. So we're going to put a towel. That way, if I drop the dentures, they don't get damaged. We're gonna go ahead and put some toothpaste on the toothbrush. And with the dentures, check for any cracks, chips, any damage. If you do notice it, we would have to tell the charge nurse about this. So we're gonna go ahead and we just can rinse them off, and then we're gonna place them in the kidney basin. And then from here, we're gonna go ahead and we can clean the dentures. So 1 denture at a time. I would like, I think it's best to put them in the palm. That way you don't drop them. And then make sure you clean all the surfaces. So just make sure you clean all the surfaces and do it carefully. So on the test, don't just go like this. Actually kind of clean every single side to make sure that everything is clean. Once it's clean, we can go ahead and put it into the denture cup. And with the denture cup, we also want to make sure that we clean it and put it with 2 to 3 inches of water. So this is clean. And then I can go ahead and grab the other denture, and I'm going to go ahead and clean all the surfaces, make sure that everything is clean, rinse it off, and then this goes into the denture cup. This can go into the hamper, so we'll place this into the hamper. And then this is the sink, so I'm leaving the bathroom. And then I'm gonna take these back to the patient. The gloves come off. These go into the garbage. I'll wash my hands, and I'll put on my next set of gloves. So this is my second set. Mrs. Gray, I'm back. Would you like any denture care? So she'll say yes. If she says no, I can actually do the closing. But in this case, she says yes. So I need to provide mouth care. We're going to put a towel over their chest. This kidney basin I already rinsed off and I cleaned. This is gonna be under their chin, so they're gonna hold on to it. And then I'm going to get a solution of mouthwash, 1-to-1. So a cap full of mouthwash, a cap full of water. So 1-to-1 ratio, make sure you mention that, that's a key point. And then I'll grab these Toothettes, I have 4 of them, and I dip it into the mouthwash solution. Before I start, I should check the mouth for any sores, white patches, redness, anything that looks unusual. So everything looks fine. I'll use the first one for the upper mouth. This goes in the garbage. The second one goes for the lower mouth, garbage. And the third one is for the cheeks and the tongue, garbage. And the last one is for the lips, garbage. So again, the first one is for the upper mouth and the roof. Second is for the lower mouth. The third one is for the cheeks and tongue. And the last one is for the lips. We'll pat dry the lips. Would you like any lip balm? So we'll put some lip balm. This will go into the hamper. So we'll place this in the hamper. And then we can go ahead and clean up the supplies. So I have a basin here. I can put all the supplies away. These are in the garbage already. Would you like your dentures in? They'll say no, so I'm gonna put this next to them on their bedside table. So it's next to you if in case you need it. I'll put the Chux into the garbage, and the supplies I'm gonna clean it and put it in their personal belongings. I'll wash hands. So Mrs. Gray, if there's anything else you need, just let me know. Your dentures are right next to you. Here's your call light, your phone, tissue, and magazines. If there's anything else you need, just let me know. So I'll open the curtains, wash hands, step outside, record, and report. This is Denture Care. So again, let's make sure to have our gloves on. We're going to have a towel to put into the sink in case I drop the dentures, at least they won't get damaged. And then I have the dentures with me here. So I make sure to, inspect the dentures for any cracks or chips, rinse them off, and then I'm gonna place these into the kidney basin. And the denture cup, I'm gonna clean it, and I'm gonna fill it with 2 to 3 inches of water. So 2 to 3 inches of cool water. And I put some toothpaste on the toothbrush. I'm gonna, again, so I did check for the cracks or chips. Make sure to clean all the surfaces and put it in the palm so it's easier to clean. And then make sure you clean all the surfaces. Once it's clean, you can rinse it, and then we'll put it into the denture cup that's filled with cool water. Then I have the other denture. Again, clean all the surfaces. And then rinse it, and again, put this one into the denture cup with cool water. And then when you're finished, just put this towel into the hamper. So that's the denture care.